Hello, Chris Turnpaugh here at Turnpaugh Health. Today I'm going to discuss two papers and then offer some opinions at the end. So this may be a little bit longer video, may also interject some of my opinions or thoughts on some of what's going on today. It's not meant to be polarizing, it's not meant to be political. It is just meant to be my thoughts based on what I think is going on. Everybody has a different angle. Everybody has a confirmation bias. So if you work in the emergency department and you see people that are perishing from COVID, you're going to have a different point of view than somebody living in suburbia who doesn't even know anybody who has had COVID. And these are both confirmation biases. So I just want to put that out there that everybody has their own opinion. I'm going to offer mine, and hopefully it's based on some sound thinking. But I do want to offer some opinions at the end. So this one may have some opinions in it after we talk about some papers. The first paper I want to discuss is called A Study on Infectivity of Asymptomatic SARS-CoV-2 Carriers. The gist of the paper goes on to say that the greater the symptom, the greater the infectability you have or the transmissibility you have. And so it's likely that if you have low symptoms or are asymptomatic, you're less likely to transmit it. Now, I don't want this to be confused with if you get the virus, if you get coronavirus, COVID-19, you're not going to be able to infect other people if you're asymptomatic. That's not what it means. But it does give us some hope that if you are asymptomatic, you're less likely to transmit it to other people. So that's an important takeaway, because if you're very, very sick, you're more likely to take evasive action around those vulnerable or around anybody, quite frankly, to protect yourself from transmitting it to others. So if you are sick, this is a very important time to wear your mask, very important time to socially distance, very important time to not be around those most vulnerable, the elderly, and the immune compromised. If you're asymptomatic, you're less likely to transmit it, according to this recent paper, which was May 13th, 2020. The second paper was put out by the CDC about a week and a half ago, and this paper talks about the 4 different scenarios of mortality due to COVID. So it goes 4 different scenarios. One is least aggressive, so low transmittability with low death rates, within some tolerance, all the way to scenario 4, which is high mortality, high death rates. And then the last scenario, which I'll discuss, is according to the most current data, what we expect the transmittability to be, and as well as the mortality based on age ranges. So this doesn't take into account comorbidities or risk factors or immune compromise or those other pieces. So I'm also going to reference some of the verbiage from Dr. David Katz, who's a Yale graduate, does epidemiology studies as well as is a practicing physician, medical doctor, well respected in our community. So I want to start off with, I'm going to go over scenario 4, which is the most aggressive scenario, followed by what is the most likely based on the data we have. So the first thing I want to talk about is the mortality rate from ages 0 to 49. So the fatality rate from COVID from ages 0 to 49 in the most aggressive scenario is 1 fatality per 10,000 people. And let me start by saying any fatality is too many. If there's 1 in 10 million that succumb to something, but it's your wife or your child or your husband or your loved one or someone that's near and dear to you, it's a big deal. So I'm not minimizing that fact whatsoever. As it has been said, we're discussing lose-lose scenarios, not win-win scenarios. So that's going to get into my opinion at the end. So the most aggressive scenario is an R0 of 3, and what that means is for every person that gets it, they're likely to infect 3 other people. So that's an aggressive R0. we think, contrasting that with what we think is going on based on the numbers we see, the R naught is 2.5, which means the best data shows that for every person that gets it, they'll give it to 2.5 people. That's reality as we know it, but we're going to go with a model that is more aggressive than that. So the aggressive model says that every person that gets it's going to transmit it to 3 people. 1 out of every 10,000 people that will die from coronavirus, succumb to it. And so the next age range is 50 to 64. So those between the ages of 50 to 64, there will be 6 people that succumb to coronavirus. So the first one is 1 per 10,000. That's 49 and under. And then 50 to 64, the aggressive model shows 6 that will die out of every 10,000. And then the most aggressive age range is 65 and older, which would be 32 per 10,000, or an average overall of 10 per 10,000 would perish from the coronavirus. That's the most aggressive models. So that is contrasted with the most realistic models we have. The most realistic model we have right now is, again, the R naught. Every person that gets it will transmit it to 2.5 people. If you're between the ages of 0 to 49, there'll be 1 person per every 20,000 people that will be fatally infected. If you're between the ages of 50 and 64, there will be 2 people with a fatality due to COVID-19 per 10,000. And realistically now, we are at 13 people per 10,000 over the age of 65. So I want to keep those numbers fresh in your mind. That is the current numbers that we're seeing come in according to the CDC. And I'm going to contrast that a little bit, and I'm going to do this a little bit throughout the video, with the amount of people that get cardiovascular disease and die from cardiovascular disease. That number is 83.7 per 10,000. And that's a recurring every year, 83.7 people per 10,000 perish from cardiovascular disease. That incorporates, of course, all age ranges. So those numbers are significantly, they're a magnitude higher than what we see with COVID-19. So the numbers are real. Every death is one too many, but we want to put it in perspective. And so that's where we're working with the current CDC models and where we're working with projections. So the most aggressive projection. I just went to the most aggressive projection because everything else is a better outcome than that one. So where does this take us, and what is this? What are now? I'm going to get into some opinions as to what we could be doing. I think there are greater risks that hide in plain sight than the coronavirus. And we think the coronavirus we have it under control if we do certain things. So let's talk about flattening the curve. And flattening the curve is taking your peak and spreading it out. The intention of flattening the curve is not to reduce the number of people getting infected. That's not the idea or goal of flattening the curve. What flattening the curve was designed to do was to take pressure off of the overloaded healthcare system that we have. So we could spread out the infections over a greater period of time so that the hospitals would be able to handle the massive influx. So a couple weeks ago, UPMC stated that they're at 2% capacity for COVID-19 patients coming in, 2% capacity. So we know from a UPMC, now that's Western Pennsylvania, they're not hit very hard. We're not comparing that to New York City. We're saying, though, that right now, Western PA, according to UPMC, they're at 2% capacity for COVID patients coming in. So we don't have a capacity block at the hospital in Western PA. Particularly, that's what I'm picking on. So there's no need to flatten the curve, because flattening the curve isn't designed to reduce the number of that get infected. It's just taking pressure off of the hospital system. Now, if this is our curve, we can flatten it, or we can kick the can down a little bit. Now, if we kick the can down a little bit because of social distancing, because of wearing masks, because of reducing the transmittability, if we take that curve and we don't change the number of infected, but we move it down a couple weeks, which we have done, that is extremely important, because 8 weeks ago, the healthcare system was a newbie at treating this. It was it's a novel virus. We didn't understand it. It wasn't well treated because it wasn't well understood. But every day, the amazing medical personnel have understood this better and better and better. And so we're much better today at dealing with this than we were 8 years ago, or 8 weeks ago. Sorry, seems like years. So it's very important too that if you get sick with coronavirus today, it's not a great outcome. I went over the statistics with you, but it's better than it was weeks ago. So I think we're getting better at managing this. And so that's a key point to realize, that doing this had a benefit to move the peak down a few weeks, or kick the can down the road a little bit. So that's important. And now we'll get into some thoughts about where do we go from here, and what do we do moving forward. So the issue, I say, is we should definitely be caring about the coronavirus. We should definitely have it on our radar. But there is a massive risk distortion propagated about the coronavirus, in my opinion. And the reason for that is, if we have 6, 10, even 30 per 10,000 that die from coronavirus, they're all too many. But again, we have over 80 die every year from cardiovascular disease. These are the issues that are in plain sight that people overlook every day, and that's just one particular disease. The reason I pick on cardiovascular disease, it is a largely lifestyle disease, which is largely preventable. So there is something that can be done about it, and we don't do anything about it. If we had on the news every night everybody, or the statistics of people that perished from cardiovascular disease, there would be much greater news to report than that of the coronavirus. Don't mistake that for me minimizing the coronavirus, but I do believe that there is a massive risk distortion that we display. Same can be made of deaths by automobile accident. So if we reported the amount of automobile accidents that there were on the road and the deaths by automobile accidents, it would be transmitted to the point where we would be afraid to get in our car every day. And so even if it was a low fatality rate from an automobile accident, because I don't know the statistics, but out of every car accident, how many result in fatalities, the number would be low, and it would still most likely be greater than that over time than the COVID-19. So putting that into perspective as, do we have a risk distortion from this? And I think that maybe we do. And so what does this really mean? Well, those at most risk should definitely take this critically seriously. So if you are high risk, or if you're in a retirement community or a nursing home, I believe you should be protected, and I believe that's where our resources should be prioritized to protect those that are at the highest risk. And if we bubble wrap those places and those people, so to speak, and if we shunted our resources towards those communities where the workers that were around these people were actually getting tested several times a week for the virus, giving us the greatest probability or possibility to protect those who are most vulnerable, that makes a lot of sense to me. That makes an awful lot of sense to me. The relative risk to people under 12 is extremely, extremely, extremely low. And has it been brought to my attention? It has, that if your child is one of those children under 12 that succumbs to coronavirus, it's one too many. Absolutely agree. But the risk factor of putting your child on a bus and going to school and them dying in an automobile accident or on the bus is greater than that of them perishing from COVID-19. That, coupled with the fact that if we send children back to school, 3rd, 4th, 1st, 6th graders, and they have to socially distance and wear their masks and not be able to play with their peers and not be able to have their cubby next to another person's cubby, with teachers constantly reminding them that it's dangerous, it's dangerous, it's dangerous to be near them, don't go near them, don't share this, don't share that. When they go to lunch, if they have to sit at their desks, pack their lunches, not be able to be children. If they're all wearing masks, they lose nonverbal communication. They don't see smiles, they don't see frowns, they're not able to express themselves in ways that are nonverbal, which 80% of communication is nonverbal communication. So that's going to breed an entire generation of fear and anxiety and potential mental illness. There are some that estimate that over the next 7 to 8 years, we can expect over 100,000 suicides based on the steps that were taken through quarantine for COVID-19. There are definitely sequelae or fallout from what we've done, and I think all of these steps need to be taken into account based on what we're doing. I think it makes the most sense to allow us, or those who are at least risk and choose to live their lives and go on with their livelihood and be able to go out. And they may get sick, they may get COVID. And as the statistics show, if you're under the age of 50, the current models show that 1 per every 20,000 will succumb to coronavirus. And every death is one too many. But that will promote herd immunity, and that will promote enough people get it that can handle it, so that those that can't handle it don't have to worry about it for the next several years to come. I think it's naive to think that we're going to come out with a 100% effective vaccine ever, certainly not anytime soon, and having a 100% effective vaccine against COVID-19 doesn't protect us against the next infection that may be coming out. We had a particularly bad flu year in 2017-18. 80,000 Americans perished from the flu in 2017 and 18. Now, COVID has taken more lives than that. But nobody talked about, or it certainly wasn't on the nightly news, that 80,000 people perished due to the flu in 2017 and 18. We have over 100,000 Americans that have perished from COVID-19. So it is definitely greater than the flu of 2017 and 18. But no lockdowns were put in place for the 2017-18 flu. Common sense should always be taking place. If you feel under the weather, you shouldn't be around those immune compromised. I just want to get the message out too that if we're not hugging our grandparents and our grandparents are not hugging our grandchildren, there is a toll, there is a cost to that. There's an emotional cost. There's an emotional need, especially amongst the elderly and those most vulnerable. They need human touch. They need human interaction. We are humans. We don't want to take the humanity out of life. It comes at a greater risk long term, in my opinion. I think, though, the risk factors that lead to increased mortality from COVID-19 are largely risk factors that can be changed and be avoided. One that we can't change is age, but how we age we certainly can change. So the message, in my opinion, needs to go from shelter or hunker in a bunker. I think that's the wrong message. Stay hunkered in a bunker for the next 100 years. And you're likely then to perish from loneliness or another disease and never have lived your life. So I don't think that's the best message going forward. I think the message is get healthy, stay healthy. Make changes today to get yourself to a better state of health. Improve how you can communicate and co-live with bugs and viruses. There are 10 times more bacteria inside of our bodies than human cells, and it's estimated 100 times more viruses than human cells inside of our body. If we took my shell and analyzed the DNA, I'm 99% bug and virus DNA. I'm 1% human DNA. So it's always going to be that, how do we live with this? Our immune system adapts and it overcomes and it develops immunity because it works with microbes and it is able to cohabitate with microbes. We talk about the microbiome in bugs all the time that live inside of us, and it has tremendous benefit to have an immune system that can juxtapose itself with the bugs that are around it. So I think there's tremendous benefit from exposure, and I think there's tremendous harm in lack of exposure. We can't live in plastic bubbles, and to think that we can come up with a single solitary vaccine that's going to fix this problem is quite honestly extremely naive. Not that one shouldn't be worked on, but that's not the only way out of this. The way out of this is to get healthy, stay healthy. I think it makes sense to allow those who are at low risk to choose to continue their livelihood. Those at low risk, I believe, should be able to go out and expose themselves. And if they do get the virus, they're extremely likely to recover. And by them going out and getting the virus and recovering, it benefits everybody else, because that's one more person that can't be infected, can't be transmitted to. There is tremendous benefit in those that are able to get sick and recover, to get sick and then recover. That is the best and most probable way out of this. It's called herd immunity. So I think it's very important I don't think we should hunker in a bunker. And I don't think we should throw everybody out in society again. Or, as was said, you don't jump back in the water with the riptides and the shark if you're the 89-year-old grandmother. I think that's a mistake. But to put people out who are at low risk, who have chosen to say, I want to go on with my livelihood, and avoid the decades of suffering from the world shutting down, emotionally, all of the other pieces that go with it, financially, people that have worked their whole lives and their livelihood is their businesses, which have seen it go away. So the statistics are what they are. Decisions need to be made. I think sitting back and waiting for a cure is a mistake. I think that 99% of the people that get it will have mild to no symptoms and recover. Now, again, if you work in the emergency department or the ICU, you're going to see those that are most sensitive and most frail, and you're going to see possibly much more death than the average person sees. And if you're the person that knows somebody who was 35 years old, got a sore throat, lost their sense of smell and taste, and their 6 brothers and sisters all lost their sense of smell and taste, but they recovered, you're going to think this is no big deal. Both of those scenarios happen. I know people in both of those scenarios. So I think it's important to see the big picture in the 80,000-foot view. But to be able to take those most vulnerable, they should be protected. And those least vulnerable should be given the opportunity to go out and take their risk into their own hands and get the virus, if they do so get the virus, recover from it, to protect those of us who aren't able to do so. I think that's extremely important. I think if we look at the risk from corona and we look at the risk from cardiovascular disease, we see that there's a magnitude of difference. And there are steps that can be taken within 4 hours of changing your lifestyle. You can reduce inflammatory markers, and within a few weeks you can reverse cardiovascular diseases. Nobody's talking about that. I think the message through this isn't build a better bunker, get a better vaccine. I think the message through this is get healthy, stay healthy. Be conscious of your health concerns. Obesity and heart disease are those things that stalk you slowly over time. So, they'll kick the can to tomorrow and tomorrow and tomorrow. And then the coronavirus comes along, and it says now it becomes an immediate crisis. And so it has brought to our attention the importance of everyday health and everyday living. And so we certainly want to promote get healthy, stay healthy, not just for COVID-19, but for a greater risk, which is cardiovascular disease, obesity, all causes of mortality, type 2 diabetes. All of those are lifestyle diseases which can be changed. We have a full-time health coach here, and I would like to offer her services. If you have questions and you don't have any idea how to start, call her. For free, she'll talk to you for a little bit of time to help you get started on your journey. These are lifestyle and society changes that can be made. You know, we talk about the transmission of COVID. It's through droplets. So sneezing, droplets, talking. So if I wear a surgical mask, I'm less likely to spit on the person across from me, which is why surgeons wear them. They're not going to transmit the droplets to the patient on the surgery table. It's not to protect me, but it's to protect others. So we know how that's transmitted. It's transmitted through droplets. But diseases of lifestyle are transmitted through lifestyle. What does that mean? If I continue to make poor lifestyle choices, I'm influencing those around me to do the same. The difference is those droplets, if I transmit droplets with COVID onto a 10-year-old, it's probably not going to have much or any effect on that 10-year-old. However, if I make poor lifestyle choices around a 10-year-old, that 10-year-old is going to take those lifestyle choices and make them their own. So we're promoting lifestyle disease every day by our actions, and we're passing on a tremendously greater risk to those around us by our lifestyle and our actions if we get healthy and stay healthy. This pandemic, as well as the next one that comes along, and there will be another one, you'll be better armed for those. So I think it's important to look at the risk factors and mitigate those risk factors and protect those most vulnerable. And I also think it's incredibly important to allow those at low risk to go out. It's incredibly important to juxtaposition children who grow up with mental illness, anxiety, fear, and depression, lack of relationship skills because they grew up in boxes in their schools, as opposed to being able to mingle and mix and love and appreciate and understand joy and nonverbal communication, develop relationships. So important. So I think there are two sides to this. I also think we need to look at the numbers and put them into perspective. It's a lose-lose. If we go out and everybody is living their lives and people get infected, there will be loss. If we stay in and hunker in a bunker, there will still be loss, and the loss will be in more ways than just COVID. And it will go on for a very long period of time. So that's a lot of opinion of mine, but it's based on the numbers. I hopefully offered the numbers to you so that you can help make an informed decision. I think it's naive for everybody to continue to wear masks for the rest of their lives and use the hunker in a bunker mentality. I think it's naive for everybody to take their mask off and throw grandma in the ocean with the sharks and the riptide. I think there has to be some logic in saying those that are at most risk, we need to double, triple, quadruple down on protecting those people. And those least vulnerable, we need to take some restrictions off and allow them to continue their lives and promote mental well-being and overall optimal health. We need to let them back into the world to mingle with microbes and viruses, not just coronaviruses, but all the bugs that we're exposed to, and develop that immunity that they're supposed to have. And develop that herd immunity. And when 70, 60, or 70% of the population gets coronavirus, we will have herd immunity. The virus will naturally die off, and those most at risk will be protected. So those are my thoughts. I know they're not popular with everybody or anybody because they're just my thoughts. So, but I hope it's helpful to put the statistics out and the transmittability we talked about. But more importantly, the most aggressive model that the CDC has come out with, the most realistic model the CDC has come out with, and knowing how many, the current data shows that one person for every 20,000 will succumb to corona under the age of 49. And then but if we juxtapose that with all of the people today, and every year, 80 plus people per 10,000 will die from cardiovascular disease this year and last year and next year and the next year. This is an ongoing burden to society, which is a preventable disease largely. So my message is, know the facts, make your decisions based on the facts. Know that, yes, COVID has taken more lives than the flu, but if we see a bad flu like 2017, 2018, we see 80,000 people perish. That's a real statistic, and that's still less than we lose from heart disease every year. So I think it's important to look at the scope and not give this massive risk distortion to one infection. Know the risks, take the precautions, do what you can, live smart, love each other, be kind to each other, understand people have fears. So there are fears people have, realistic or unrealistic. So fear sometimes is an unrealistic fear, but it survives inside that person. So if we can come together on common ground, my common ground is those most vulnerable, we need to double down. We need to take the actions and exaggerate them. And those least vulnerable, we need to remove the restrictions and allow them to get their livelihood back so that we don't have decades of mental illness. Children are suffering. They're going to suffer even though they're the least vulnerable population for the coronavirus. They're going to have the most mental and physical disease fallout from this because of the steps we're taking. I just think the whole picture needs to be presented. The ongoing message again is get healthy and stay healthy. It starts with lifestyle. If you would like some information for free, call Carrie or Aaron, both of our lifestyle coaches. One's in Mannheim and one is here in Mechanicsburg, and they would be happy to offer some advice to you just to get you started on your journey. If we can work together as a community to get healthy and stay healthy, we won't have such a horrible outcome from a disease that floats around or worry about the next pandemic quite as much. So it was a little bit lengthy, went 32 minutes plus. I hope the information that I shared with you was helpful. If you just want to do the statistics, focus on the first part. If you care about my opinion at all, the second part. If you have any comments, I welcome your comments. I don't have it all figured out. I said early on when I made these videos that this virus is going to make us look silly, and it has. Very silly. Both sides, right, left, center. Everybody looks silly at times. So please bring back any kind of comments or feedback. I'm happy to share what I know. If it's helpful, I'll continue doing these. Guys, stay healthy and have a great day.